I see Sonia. I see
Oh, there they are. I see them.
Yeah.
All right, so let's go ahead and get started. And what is today, by the way?
Tuesday, April 7, 2020.
Yeah, welcome to the Tuesday, April 7th, 2020 virtual meeting. And Gary, why don't you start?
Yes, we'll start with roll call. Chair Bernard.
Here.
Commissioner Humberston.
Here.
Commissioner Fisher.
Here.
Commissioner Savas.
Here.
Commissioner Schrader.
Here.
All commissioners are present. We will begin, as always, with a COVID-19 update. I'll ask Nancy Bush, Director of Disaster Management and Incident Commander of the Emergency Operations Center, to begin, please.
So good morning, everyone. And I will start with our numbers for the day. So for the state, we have 1,132 positives, 29 deaths statewide, and there are 2,669 negative tests. For Clackamas County, we have 90 positives, 3 deaths, 1,870 negatives. Multnomah County has 243 positives. They have 7 deaths and 4,828 tests or negatives. And Washington County has 271 positives. They have 5 deaths and they have 2,785 negatives. So just a few things to let you know. We have been receiving PPE, which is personal protective equipment, from the state. We've had, over the past 5 days, we've had 3 shipments. A couple of those were pretty small, and then the last one we got was 3 pallets. We have been going through each shipment. We've been checking the equipment and before we send it out as best we can. We can't open every box, obviously, but we're doing spot checks on those. We're making sure we're doing a count and comparing that to what we have in the packing slip to make sure that they match. I will say some of those things are not matching, so we'll be addressing that with Oregon Emergency Management as well as OHA. We continue, we have really good conversations with our city emergency managers. We're doing that on Tuesdays and Thursdays. And this morning, for example, we had a very good conversations about what they're doing for their business communities. And so we're going to try to capture that and bring that to the BCC at some point whenever we have a little bit more details on that. But there's a lot of good things going on out there. Here in the Emergency Operations Center too, we're adding some liaisons for some of our more diverse populations, including those are non-English speaking, migrant workers, working more closely with those who work with domestic violence victims. So we are adding that here so we can get more information out to them, make sure that we're answering their questions and that they're a population that are included in all the information that we're sending out from our public information group. Also on Monday, yesterday, our operations group pulled together making of the food boxes. And we did have some of our commissioners that actually went out and delivered some food boxes to our residents. We also had county staff from Clackamas County Sheriff's Office, Social Services, DTD, as there may have been some others. I don't have all of that. Hopefully I didn't leave anyone out. But it was very, very successful, and that is something that we plan on doing weekly as we go through the event. So I don't know if you have any questions for me before I have Dr. President give her presentation.
Commissioner Savas.
Yeah, Nancy, thank you for all your hard work, and thank you for responding to my emails. When you're beginning of your presentation, you're speaking about going through the inventory, and based on what I'm still trying to discover, actually, to some degree, I'm curious as to that. You mentioned in one of your emails the distribution as defined by this group, right? And I'm sure that's on a priority basis, and understanding that the distribution to the hospital seems to be handled differently. I guess between that article that came out of the Oregonian over the weekend, coupled with this discussion or potential of seizures of some of the materials by FEMA, if they felt that some of those materials were either damaged or dry rot or whatever it may be, Some of that, I guess that some was confiscated. Maybe seizure is not the right word. Confiscation might be the more better word. But I just want to make sure or know that our communication network between the people on the front lines in the emergency rooms and the critical care and all that communication, that they're actually getting it to them, because if it actually was delivered but it was then subsequently confiscated, I'm kind of concerned that maybe that most important prioritization of need is not met. So are we doing a double check, triple check to make sure that that's occurring, that critical PPE is making it to where it needs to go?
So as far as, so what happens here in the state, so we get the cash in from the federal government, and then it is actually sent out to all of us. And you're right, the hospitals are done a little bit differently because they look at our population regionally, and then so we get like Clackamas County will get like 10,000 N95s, for example. And then they pull off of for the region and say that this goes to your hospital system. And so that is being distributed through Multnomah County. So whenever we get it, there's no one in between that's pulling things off. So if anything is being held back, it's not here at the county level. I'm not sure I'm exactly answering your question. But I will say too that we have been working with the hospitals, and we're on calls with them on a regular basis. And we have not heard of anything like dry rot or any of those things that are coming from the cash that we've been handing out here. I'm not saying that won't happen in the future, but it has not happened so far.
Yeah. So, yeah, just to put it simply, it's just important that we make sure that the frontline people in the hospitals are getting what they need, and that on these distributions that they're actually receiving it through whatever systems are put in place. And if there is a means of that double checking or triple checking, I would certainly be relieved.
I certainly understand that. And over the weekend, I did do the check, and I did send you the information, for example, what we know that Kaiser did get. And, you know, some of the others, you know, I can get Providence, I can get all of that check. And I did do that over the weekend, and I can do that on a regular basis.
Okay, thank you.
All right, Commissioner Humbertson, and Mr. Chair, you're muted.
I just have one question. I'm not sure whether Nancy or Sheriff Roberts can answer this question, but has there been an increase in domestic violence in Clackamas County that the Sheriff's Department or our social services departments have had to respond to?
So I will start, and then I can turn it over to Sheriff Roberts. We do know that there is an increase. We do know that our I-911 centers are seeing an increase in domestic violence calls. And Sheriff Roberts, would you like to add to that?
Your mic's muted. Oh, there you got it.
Yeah, we can go over that in just a minute as in our presentation and kind of cover all crimes, if that would work for everybody.
Okay, thank you.
I just wanted to note that Nancy is writing a letter, the Tri-County chairs. Well, you know, we get deliveries. We don't know what the formula is. And so we're sending a letter to the state asking that they define the formulas. And you guys will see a draft of that.
Okay.
All right, Mr. Chair, Commissioner Fisher.
Commissioner.
Yeah, I just wanted to mention I was on my leadership call with AOC Health and Human Services yesterday, and Paul, the topic that you're concerned about was basically the crux of the conversation, and AOC is also going to be working on this issue. How is the distribution, and how are we assured that it's getting to hospitals, and formulas, and what's the criteria? And we're going to be facilitating that conversation with OEM through the state. And I just wanted to let you know that that's taking place as well.
Okay, thank you. Okay, if there are no more questions, I am going to introduce Dr. Sarah Present. And Dr. Present is our health officer here for Clackamas County. So Dr. Present.
Hi, everybody. Thank you for having me here. I really just wanted to check in with you, as it's been a while since I've seen everyone here. I wanted to make myself available for any questions you might have from the health officer perspective. Things that I have been working on, you may have seen me in the news on Friday night talking about the new CDC guidance around mask use. That was a rapidly put together piece. And then I do have another media engagement this evening, again, around the mask use. So I just want to, I feel fairly reassured right now by all of the data that we have in the metro region. The PPE supplies is still my main concern. And, you know, Nancy and the EOCs are doing a great job of coordinating that. But as far as hospital beds, ICU beds, ventilators, that sort of thing, we have flattened the curve and everything is looking pretty reassuring. The last modeling that came out that OHA has been looking at was on the 30th. It's about a week old. I anticipate some more soon, but I don't have any other indications to think that you know, we're beyond capacity of our healthcare system at this point. The recommendations for everybody to have facial coverings that came from the CDC is primarily for places that have, you know, is significant community spread. I think that it is a good idea for us to all be doing this to help continue to flatten the curve. That's going to be the best thing for our community overall. I think that we, at the same time, don't need to enforce this or be super strict about this because we are not at a point that we are really in the same crisis as far as spread. Again, we want to do what we can to keep us from getting there. I think what we're doing is going well. I'm feeling pretty reassured. I think that what we're going to be looking at over the next weeks is what, how do we start lifting these things, and what does the science look like around, you know, resurgences and further peaks and that sort of thing. And I don't have answers for you about that right now, but it's definitely on the top of my mind and other senior health officials. So I just wanted to be available for questions that you guys may have for me.
All right, Mr. Chair, Commissioner Savas. And
Yeah, my question, Dr. President, is that I'm hearing different numbers on when we might anticipate a peak in Oregon or a peak in our area. And I'm hearing from one end that it could be like in the next week or so, and hearing various numbers all the way into May. Any sense that maybe that peak might be sooner than we anticipated?
No, I think our initial modeling was looking at right around now. Again, we have been significantly sort of flattening that curve, which makes the peak then end up later and later. So as we keep it flat, then the anticipation of when the actual peak is can move on. I have heard as late as May based on having flattened the curve, so the peak is later. I really am looking for some more modeling information after this last week, because I think that that can make a big difference in what has happened in the last week. So I don't have a great answer for you. But we all are concerned about a potential resurgence next fall, depending on how things go as we go into summer.
All right, Commissioner Schrader, then Commissioner Fisher.
Yeah, Dr. President, how are the hospitals in the Tri-County collaborating?
So
and
we have
is that including every. Yeah.
Sorry, go ahead.
No, and how many? I'm assuming the entire county is involved in that, and that, to my knowledge, we don't have any small rural hospitals in this county compared to other counties. So, yeah.
So our Tri-County Health Officer, Dr. Jennifer Vines, is in discussions with higher management of the hospitals on a regular basis, and I communicate closely with her. The primary communication that I have with hospitals right now is a 3 times a week call with the hospital systems. That's Monday, Wednesday, Friday. And that includes infection control practitioners and infectious disease doctors at all of the major hospital systems. It also includes Adventist, Shriners, Peace Health in Southwest Washington. So I believe it definitely, there are representatives from all of the hospitals, and now the Health Share participates, as well as Care Oregon. And so it has actually been growing over time. And on those calls, we talk about what the different hospitals are doing as far as protocols around testing, protocols around very specific things around surgery and different procedures, and how it's a great sort of information sharing forum for people to ask questions of each other, see how people are managing different situations, like what are aerosol generating procedures, how are people managing laboring women, discussions about discharge planning, and PPE usage, so that there is some consistency across the different hospitals. And if there's not, we are aware of what those inconsistencies are and what the reasons for them are. So I think that's the main way that we are communicating with them. And then there's also the Hospital Preparedness Organization has email access to everybody around other sort of emergency planning activities.
And at this point in time, with the patients they are treating, we're not near the kind of situation like they're having in New York or in Detroit or Louisiana. The hospital systems at this point are not stressed beyond capacity.
That's correct. As of yesterday, I heard that there was green light from several of the major ones. I can't recall exactly what we were saying, but yes.
Okay. So they're ready for a surge.
As long as there's enough PPE for everybody to keep everybody safe.
Okay.
Otherwise, our hospital systems seem ready for the surge. Yes.
Okay.
All right.
Thank you.
Chair, before you go, Commissioner Fisher, we had a question from Nancy Bush through Dan Johnson to Dr. President, asking to clarify the purpose of the face coverings. They help to contain rather than protect the person wearing.
Yes. So science around facial coverings is limited. What we do know and have anticipated for quite some time, that there is pre-symptomatic or asymptomatic spread of this disease. I believe Commissioner Fisher was asking me about this early on. There has been more science that sort of proves the impact of that, to a point that facial coverings is recommended in order to limit spread by mildly symptomatic or asymptomatic or pre-symptomatic individuals. So the hospital grade masks like N95s N95s in particular are manufactured and made to protect the wearer from any airborne particles from getting into their respiratory system. So it has a tight seal on the face and it keeps things out from the wearer. So that protects individuals. The surgical masks are really more manufactured for fluids like splashes. So it does protect the wearer some, but as far as airborne particles and things that might be inhaled, there are openings at the sides, and they don't protect the wearer from airborne particles as much as they do from splashes into the face and mouth area. And then they, because they have that sort of waterproof capacity, then they protect others from what the wearer has and may be exhaling. So for use in surgeries, when you need to have a sterile field, the main a primary use of wearing a surgical mask is to keep the surgeon from infecting the sterile field with anything they may be carrying. With facial coverings, given different fabrics and that sort of thing, it really is, there's not good science about how well it protects individuals from, aerosolized or airborne droplets from getting into somebody's mucous membranes. Similar to surgical masks, there's potential for infection still. It's thought it's less so, but we don't know, because it doesn't have the filtration capacity of like the N95s, then certain particles that are small enough could still get through that. What it does do primarily is stop respiratory particles from being expelled farther away from the individual who's wearing it. So again, there's limited science, but the main benefit is to protect others from the one wearing the facial covering, and to, we talked about the 6-foot sneeze, right? We also know that talking expels some respiratory droplets. singing, speaking loudly, depending on how much sort of force of air you have coming out, there's different amounts of respiratory droplets that are leaving an individual's body. So the facial coverings are meant to stop those. So, and okay, thank you, Dan.
All right, Commissioner Fisher.
Thank you, Kevin. So I'm curious about what is the criteria or the thought or just the process that you and your colleagues will be going through, and it will probably most be likely on a local and national and statewide basis as we begin to get out of this.
Mm-hmm.
And begin to reopen more sectors of the economy. What will we be looking at, and how can we as elected officials be somewhat alongside? It seems that we've been, and it's not just me, it's other elected officials as well, have been asking questions, and then all of a sudden, oh no, the schools are closed, and oh no, I mean, everything happened so quickly. If we could have an idea of what the criteria is used, if it's modeling, or if it's when we get an antibody test and we can test it, or when we can find out who's contagious, or when we can, if we identify sectors of the community. I mean, I'm just not sure what the best thinking is, and what I just would love to get in the brain and hang about these things.
Yeah.
It will help us moving forward.
So we are looking at both the modeling and the science as it emerges in other areas that have been hit with peaks prior to us. You know, looking at China and looking at other areas, even Italy, and, you know, who've had an earlier peak and what happens afterwards. Vaccine development, antibody tests, again, we're kind of waiting for the science to be better to understand how those could be beneficial. And I think that as far as I think that going into this, I realized that there was a lot of very rapidly changing information and very decisions that had to be made very quickly. And some of them, you know, I had input to, some I didn't. I think that coming out of it is going to be a more, I have hopes for it to be, give us time to have some more thoughtful interactions and discussions about the impacts.
I think I
and I
mentioned
will meet with you guys here. I will be in discussions with Nancy and with our PIO group, and we'll make sure that we communicate what we know. And right now, I don't know a lot. I'm sorry.
I think I mentioned it when we came on that this is probably going to be the toughest part of this whole process, is determining when we're ready to go. I think it's going to be, you know, June before we can really open up if we're lucky. So I've been, the RDPO discussions we have, AOC and others have all mentioned that this could be a big challenge. You know, the interesting thing, Doctor, is that in California, where the weather's always nice, they're still getting infections. I mean, it's in the 80s in Southern California, but they're still growing. So I don't know how we can say in the summer this is going to drop off. I don't know how we can say that. We probably can't.
I don't know that either. You know, we think about a lot of viral illnesses being more in the wintertime, but there are a lot of factors that go into that, including people being inside and being close to each other more. And if we're taking that factor out of it, then I don't think it's really clear how temperature itself is going to affect infectiousness.
Yeah,
I do think that looking at our peaks and valleys, it's more of these curves. So we flattened it. It will go down just because that's how things work. But then when they go back up will depend on what our actions are. There was a really nice New York Times article recently that looked at sort of implementing social distancing in phases, sort of like on and off again, like going around a curvy highway where you put on the brakes sometimes and then you let it up. And I'll send you guys a link to that article. It's an interesting way of thinking about possibilities for the future.
Great. Any other questions?
Commissioner Humbertson.
I just think that unlike when we first started this, which was a proactive stance that we took, because your science and your modeling is constantly changing, we're going to be in a reactive stance in terms of when we actually back off of this, and we don't want to get out, as somebody says about me sometimes, we don't want to get out ahead of our skis on this and risk other people's safety unnecessarily. So it's going to be, I think, a slow process, and we want to err on the side of caution, I think, and let the numbers really dictate. So just my comments, that's all. Thank you.
Thanks.
Thanks. Any other questions of Dr. President? Seeing none, well, what's up next? Sheriff? Or?
Yeah, so thank you, Nancy and Dr. President, for your presentations. Next, Commissioners, you had requested that the other elected officials of Clackamas County come here at issues to give an update on how they are leading their departments during this COVID outbreak. And first up then is today Sheriff Roberts to give a quick update on what the Sheriff's Office is doing during this emergency. So please, Sheriff, go ahead.
Hey, thank you, Gary. And just to kick this off, I just want to extend a big thanks to Jenna Morrison and running our jail and community corrections, Angie Brandenburg, who's just, all of these folks have really been working around the clock. And really my heartfelt thanks. It's been quite busy here, and I think as I go through some of these things, you'll be able to hear how we have been incredibly busy. So, also I want to give a big shout out to Dr. Sarah Present, who has really given us some amazing guidance in some cases that we've had at the jail that have given us a lot of concern, and thank goodness I followed her directions and things worked out well. So thank you very much, Dr. Present. So I think what I'll do is start it off by just talking about jail operations first. We'll go through a lot of other issues that we want to brief you on. And really, on one hand, we were fortunate we had kind of a high-risk case at the jail early on in this whole process. And that was one of the things where Dr. President gave us some advice. We had a person in our jail, temperature, cough, and some other symptoms similar to COVID-19. And in essence, the person was transported, tested a negative. But it really also emphasized the impact that it could possibly have on our jail. So actually, thanks to Captain Lee Eby, he actually created a COVID-19 jail protocols. And that model actually was pushed out across the state. So the majority of jails across Oregon are actually now following that protocol. On March 13th, we actually implemented medical screening of inmates in the Sally Port, which is even before they get into the jail. So that was one of the first things we did. Following very shortly after that, on the 16th, we actually put out a restriction to all local law enforcement agencies, placing some restrictions on bookings at our jail. And then following that, on the 18th, we actually implemented taking inmate temperatures on a daily basis. So on the 26th, we actually moved to following the same practices that hospitals are following as far as screening of our staff, patrol deputies, anybody who crosses the threshold to come into our jails. So really trying to provide a number of checks and balances to prevent COVID-19 getting into our facility. Recently, we're also in the process of the homemade face masks. We're actually going to be providing those to every inmate, and actually they can be laundered on a regular basis. We're also, folks that are coming into the jail, they're more or less the ones that we do have to take or not put into general population. They're really set aside in a quarantine type manner before they're mixed in general population. So all of those things I believe are having a a positive impact that are preventing getting COVID-19 into our jail. I can tell you across the state, they obviously have it in the penitentiary and some other places around Oregon. One of the things that has also been a concern is the increase in 911 calls, which was brought up earlier. We are seeing an increase in those calls, and one of the things we're working on a state level is to look across Oregon, what are those crimes that we're receiving an increase in calls. I've asked Under Sheriff Angie Brandenburg to talk about those, and I'm going to turn it over to her now to talk about the what we're seeing as crime trends.
Hey, good morning. So really the impacts for patrol, we've seen an increase. We pulled our call stats from last March and compared them to this March. And we are just like the rest of the nation, quite frankly, and seeing increase in several categories of calls for service. We've seen a 16% increase in domestic violence. We've seen a 12% increase in child abuse, and being mindful that school is not in session, and that's where we do get a lot of our calls for service during the school year, and so that's concerning. We have seen a 6% increase in suicide and suicide attempt, and a 13% in our mental health calls. The biggest category, which was very interesting, is a 43% increase in burglary. And a lot of those are our rural properties in the county. So I don't know if anybody has any questions about that, but we're definitely on par with I believe the rest of the state and the rest of the nation. I know that there was an article today, Police One, about domestic violence is on the increase. People are cooped up together. And then a lot of our folks that we are taking to jail are mandatory arrests for domestic violence.
All right, Chair Bernard, we have Commissioner Fisher, then Commissioner Humbertson, then Commissioner Savas.
Go ahead.
Hey, hi, Angie. Curious about child abuse. With children being more isolated at home, where are those calls coming from?
So these are to patrol. So these are 911 calls into patrol. I think that we're the 307s, you know what those are, our DHS referrals that we take in. We take in about 3,000 of those a year. Those have dramatically dropped. And that causes us concern because we know that once we're on the other side of this, that we are gonna see some severe impacts and a boomerang effect, right, with our calls and investigations.
Okay, my next question is in regards to domestic violence. I noticed that in our emergency, another amendment that we're doing with our emergency declaration, we're looking at Class C felonies. I'm curious about how domestic violence plays into that and releases from jail, and if we're making sure that those perpetrators are staying.
Yeah, those are obviously our same concerns. Domestic violence is big on our list, but they're mandatory arrests, and they're coming to the jail, and they're being processed like normal. We have prioritized who's coming into jail. Obviously, we're trying to limit the amount of offenders we have in the jail. So we've done, a great job of prioritizing, and those are on our prioritized list.
Okay, Ken?
So Angie, when you say that a domestic violence perpetrator is on your list, does that mean that they are more likely to stay in the jail as a result of their behavior?
Yeah, they're a mandatory arrest, so they automatically come to the jail. Deputies don't call first, or other officers in our jurisdictions, because they're a mandatory arrest. So there's some things that we have discretion over, and those are not one of those that we have discretion over.
Okay.
We do medically screen them when they come up. Obviously everyone, because it's we're trying to weigh the benefit and the risk for bringing folks into the jail. And like the sheriff said, we are taking steps to make sure that people are in an area, not bringing it into the general population before they get, if they have to stay with us.
But we're not matrixing them out.
We're not matrixing them out.
Okay.
So they can bail and they can be arraigned like normal. Yep.
Yeah.
Yep.
Okay.
I realize it's a delicate balance that you're trying to work here, so I appreciate the difficulty of it. The statistics that you gave us, are those for public knowledge, or would you prefer they be kept out of the public at this point?
No, those are the stats that we've pulled. So they're public consumption, and we provided those to the Oregon State Sheriff's Association, they're polling all of the sheriff's offices to see where everyone's at. But I think we're probably on par with most places in Oregon right now, sheriff's offices.
Okay, are they specific to, are the statistics you gave us specific to Clackamas County, or are they statewide numbers?
Those are ours. Those are the sheriff's office only. So it doesn't include our police departments, but it includes our contract cities. So it's everything Clackamas County Sheriff's Office serves in the county.
Okay, thank you very much.
So I think Paul was up.
Yeah. So I have actually two things, but one's a question. Have we seen a spike or an increase or a trending towards a need for more vouchers or housing for victims of domestic violence?
So I can talk anecdotally because I talked with Melissa Urban with Clackamas Women's Services that I believe their shelter is closed, obviously. So I believe yes, but Melissa could probably answer that question better than I can. We call them, obviously, when we have the partnership with CWS, when we have someone who needs to be housed, and if they fall within the criteria, Clackamas Women's Services provides the vouchers, puts them up in hotels if necessary for us.
Okay.
For safety issues.
Okay, thank you for that. The other thing I just wanted to mention, it's just more of a comment, is that a 3 months ago, I signed up on Nextdoor. So I don't participate in it, but I do watch things coming in. Definitely a lot of issues about suspicious activity, burglaries, and things like that, and people talking about taking the law into their own hands and so forth. So concerned, and I don't know if you're seeing. Well, you mentioned the 43% increase in calls. So more people are home, and there's probably more eyes and ears in the neighborhood. But I would be concerned about people reacting because they're home and they're watching something like that happen.
Yeah, I mean, I hear that, but we haven't seen that. I think people talk a lot about that as far as taking matters in their own hands. We're not seeing that. I know I live out in the rural South County area, Malala area, and our neighbors were burglarized. And I was asking my other neighbor, I go, oh, they were home. And so I think what we're seeing is the like outbuildings and different things. So not necessarily people's homes. I could dial down some more of the burglary statistics, but I think it's more because people are home. But I think that what we're seeing is not necessarily homes, but more of stuff being stolen.
Who's next?
I'd like to.
Commissioner Schrader.
Okay.
Yeah, I wanted to go back to the jail piece with the containment. When you do your medical screening, do you have tests available for COVID-19 at this point?
No, that's not part of the screening. So folks need to exhibit signs, but typically they're going to be taken to the hospital.
Okay.
I'd like to. I have worked also with Melanie in Jail Health to ensure that they have a handful of test swabs in case they are needed for some reason, but most will be transported. I agree.
Okay.
You know that.
So
we're in discussion to make sure they have what they need.
Okay, so it's any symptom. It may be a cold, but you have to be careful. Is that what's happening?
Yeah. So we have tests available, but that would not be somebody that we would test. So really following Dr. President's guidelines for who gets tested and how they get tested.
Okay.
But we do have tests available at the jail if and when we need it.
And they have my cell phone number, so they can call me anytime to talk about these things too.
And we will.
Which we do. So I think that's a good transition point. I'm going to turn it over. Oh, I'm sorry.
Sorry, I
Go
have
ahead.
some more. Are we done with that? The stats? Okay. I thought that was very interesting for us to know. So I want to talk a little bit before I go about our patrol response. So we ended our in-person roll calls. We started our Zoom roll call meetings on the 13th of March, which has been pretty successful once everybody got the hang of how to do a Zoom call. And so deputies are right into the field, and they're not coming and joining up together, which is problematic in a way because it's a lot of the esprit de corps of getting people together. So it's been really hard on staff. But we've moved some folks into patrol. We moved our traffic unit handling patrol calls, our school resource officers into patrol. And then if necessary, we'll move over to 12-hour shifts if things get bad. Hopefully, knock on wood, we're doing social distancing with our patrol staff and being very mindful to not, contract COVID. One area that gives us some concerns are death investigations and making sure our staff are fully equipped with PPE to respond to death investigations. But we've been working with Dr. President on that as well. So one last thing, unless you guys have any questions about patrol responses.
Any questions?
Yes, sir.
Nancy?
Just to add to that, the medical examiners are making sure that they do have some PPE in the field for any officer that needs to go in with them. So I want to make sure the undersheriff knows that as well. So we're trying to make sure that all are protected on the desk.
Yeah, yes, we do know that. Oftentimes we're the first ones on the scene with fire and medical. So just being mindful about who really needs to go into the scene and making those decisions, our supervisors, making sure they're involved and not necessarily exposing folks, but really it's, if someone has COVID and they're living with family members, the likelihood of other people being positive are pretty high. So just trying to be very mindful about that and having a plan.
Any other questions? All right. Thank you.
So one more thing is just to talk quickly about our community care initiative, and thank you guys for coming out and packing food boxes. And so we started this up because we know that that our elderly are going to be, they're shut in, and I know both my moms are shut in, and so making sure that we're taking care of needs of that community. We're doing some phone reach outs. We're being proactive about that. And part of that is being able to provide the food that comes from the food bank, but working in partnership with Nancy and the EOC and H3S Social Services, Food Bank, and the Sunshine Division and other nonprofits to trying to meet those needs before we really see a need, because we know that our patrol folks are very generous and they really want to take care of folks. And I could see them going out, opening up their wallets to purchase items for folks that they come into contact with. So giving them the ability to be able to get those resources and get them out to the community. And then so our staff, other county staff are involved in this, and also we have tons of volunteers that are wanting to volunteer, and then we'll have a volunteer process if other folks want to also join. So really being proactive and doing the phone calls to our senior vulnerable population, and then as needs emerge, we can expand from there. But just wanted to kind of give you an overall idea of what we're doing there. The Clackamas County Peace Officers Benevolent Foundation has a donation tab for folks who feel the need that they want to donate to help out. And so talk to Nancy about that. And that's been a need, I think, of the EOC for a while, just to have that 501c3 involvement. So unless you have any questions about that, I'll turn it back over to Jenna. All right, thanks guys. So Jenna Morrison's gonna talk about.
Hello. I'm going to update you just on what's going on with community corrections and civil. So at CSAP, in our residential facility, we have downsized to one building. Having two buildings just had too many staff needs, so we were able to go down to one building. So we're staffing that, and then the sheriff will talk about what we're doing with the closed building. The transition center did close. Obviously, we were social distancing and only prioritizing our most necessary operations. Our community service crews have been suspended. We do have pretrial that's continuing. We still have people that are getting into the jail every day, although that's diminished quite a bit. Parole and probation main office on Main Street is still open because we still are getting prison releases and the court is still open, but we're open on a very, we have very limited staffing because there's not many people coming into the building, but we do have to remain open. At our civil division, first I want to talk about our concealed handgun licensing. So we stopped all new applications because they do have to be in person, and we closed down the Public Safety Training Center, which is where we usually take in the new licenses. However, as of yesterday, with the help of county IT, we are able to do the renewals online. So we are doing those, and we've also kind of put the word out that if there is an expired license, a recent expired license, to give a little leadway, since there has been the ability to renew. We are also processing revocations, just like we have been. We have our staff kind of working from home and then coming in on a limited basis to make sure that those things get done. Moving on to civil, we are not doing any of the forcible evictions and detainers. We are on a 90-day, or not for the next 90 days, and we're asking for a 120-day set over for anything new that comes up. We are still process serving all of our civil notices and summons, and we are still providing court security. The court remains open, except for Justice Court, which is, I think, closed except for on a limited basis. Any questions? Okay.
Any questions? Thank you.
All right, we're almost done here. And the next thing I just want to touch base on is PPE, which has obviously been something that we want to say a big thanks to Nancy Bush and her hard work. And it is a difficult position she's in because it's trying to make everybody happy. And I know Nancy's doing her best. So thank you, Nancy. We've worked really hard on prioritizing our PPE and consolidating it because we were actually getting it from every division. Finally got together a complete report from all the areas, jail, patrol. One of the big things we're working on, which is also a statewide request, and that is determining our burn rate. And so I think we're finally to a formulary that I feel like we're getting it nailed down about really true numbers of what our needs are. And I think a lot of people might be reaching high and just wanting to make sure we're meeting our needs. So we have been disappointed a few times. We actually had a number of different orders in and we're expecting a supply, and the feds put a hold on it and took it out of our hands at the last minute. So we actually, I did want to say that when it comes to face shields, we were able to actually purchase some face shields, and that should be getting here relatively soon. On our request for PPEs, we got about half our order, but again, you know, we're working closely with Nancy to keep her abreast of our need regarding that. One of the other things I'm concerned with the nice weather coming, it happens to be the use of our forest lands and recreational trails. The Oregon State Sheriff's Association, we did work with the Forest Service, and as you know, that is closed. All the trailheads have been posted by the Forest Service, but I unfortunately anticipate a use of those as the weather increases, it gets nicer. So the other thing I wanted to brief you on is which I feel like we've been doing a really good job trying to look ahead and planning for the future. Taking a look at New York, New Jersey, around the country about how law enforcement is being impacted by this. I can tell you in the New York, there are 50 FBI agents suddenly went down with COVID-19. Obviously, hundreds and hundreds of police officers there. So we have created a plan in place that if it unfortunately gets here, which I'm hopeful it doesn't, that we have converted the women's CSAP building, the old residential building, into people that might test positive for COVID-19. We moved the women from that facility into the men's section, which is how it used to be some time ago. And so it is all set up that if we have people test positive for COVID-19, they have a place to go, and that we have worked on a plan of having a nurse check on staff that might be there. We also came up with a secondary place. We're having a lot of concern from the employees about going home and potentially impacting their family. And we've converted the Bowman building, one area of the Bowman building, where if you are non-symptomatic, you can stay there, and made that available. And the third thing we did was work with parks. Barton Park is set up if folks that don't want to go home and contaminate their family or take that risk, that they can also take their RV to Barton Park and stay there. So those are some of the things we've set up for the employees on that aspect. I did want to, Nancy and I are both on a statewide call every day at 1 o'clock, Saturday, Sunday. It becomes a long week, but I represent the Oregon State Sheriff's Association on that call, and just want to make sure you're aware of a few things that I'm seeing, both on a state level and also I can impact us locally here. So the first thing that we made a request, statewide request for the operations center. We're asking that 911 dispatchers have the ability to flag COVID-19 hotspots and confirmed COVID-19 cases in our CAD system. So what that benefits us is having dispatchers can notify police, EMS, and law enforcement when they're approaching a location where exposure is possible. We're not asking for names of these individuals, basically just a heads up using universal precautions. I wanted you to know it was implemented in New Jersey. The Attorney General ordered that, sharing the information for law enforcement, and also in New York, and giving frontline responders a heads up, which would be much appreciated. We haven't gotten an answer back. It did sound like that was a doubtful we would have that approved. The other thing that is having an impact is this state mental hospital are not taking any mentally ill patients. What this is impacting both locally and across the state is we can manage those inmates for a short period of times. It does create some problems having them in our county jail longer when really they should be going to this state hospital. Wanted to give you a heads up on that. The other thing that I wanted, there's another committee statewide that I'm on that has to do, that is led by Oregon State Police, and it's tracking COVID cases for law enforcement and dispatchers across Oregon. And what we are seeing is more tests increasing slightly for positive COVID-19, where actually the individuals that are being tested, though, we're seeing as the majority of those are coming back negative. So to give you an idea, on the 1st of this month, there was 63 that were really on quarantine status. On the 3rd, it dropped to 43, and the majority of those, as I said, are testing negative. We actually have 29 law enforcement officers across the state that have tested positive for COVID-19. So trying to pay close attention to that. You may have heard on the news that there is drive-through testing in Hillsborough and also for law enforcement, a priority can get in there. So I also wanted to just make sure you're aware that that we have done a lot of planning regarding our own department operations center, that we're ready to step that up if the need arises. Right now, we're really in a holding pattern, and I think that has covered about everything. Any questions?
Commissioner Fisher.
Thank you, Sheriff. I'm curious how big of a problem the Oregon State Hospital being closed statewide is. I know that before COVID, Sharon Myron and I were working pretty extensively through AOC with Steve Allen regarding looking at our community resources to keep people out of the jails, out of the Oregon State Hospital, looking at our community capacity. We were well on the way of planning that, then COVID hit. And so I'm just curious how this is all playing out. I know that Unity is in a real tough spot and with the situation they have there, and I just would love you to just give a little more depth on that.
Yeah, I would just say that really, yeah, this is just putting the delay on a lot of these individuals, and there really are high risk, people struggling severely with mental health issues, and the state hospital is the appropriate place for them, and really our facility is not really set up for the needs that those individuals have. I would also just say that, you know, Unity unfortunately has been struggling for some time, and it has some pretty big challenges ahead of them.
Well, thank you, Sheriff. If there's no other questions. I had one of Nancy, and I don't know if you can actually answer this. Do we have any cases of county employees?
I cannot answer that.
Okay, thank you. I didn't think you could.
No, I know a number for the county. I don't know any other specifics.
Okay, thank you. All right, looks like we can move on to the next subject. Thank you very much for your time. Great reports, and Sheriff, you're doing some amazing work.
Thanks, Jim. Have a great day. Hang in there.
Thank you, you too.
Sheriff, if you please stay on for a second, because we're going to do updates to the emergency declaration yet, and there are two that relate to your operations. We may have questions. So Stephen Madcourt, County Counsel, will next discuss potential proposed updates to your emergency declaration.
Good morning. Thank you, Gary. We have a proposed second addendum to the emergency declaration where we are proposing additional emergency measures. We have 6 proposed. The first 2, 5 and 6, concern the Sheriff's Office. They were submitted to me by the Sheriff's Office. And 5 deals with the Sheriff may release any adult in custody who is being held on a misdemeanor or Class C felony as the Sheriff deems necessary to ensure the safety of staff or adults in custody. Previously, there was a question concerning the details of that, and hopefully, Sheriff, you're able to respond in more detail what the reasoning is behind this emergency measure.
I'm sorry, Steve. I am really struggling to hear what you're saying. We were trying to adjust our computer. I'm sorry to have you.
Is anybody else
it.
having a hard time hearing him?
No.
No?
Number 5 and 6 were 2 emergency measure proposals submitted by your office. Can you hear
Emergency
that?
measure proposals.
Yes.
You have it?
Yes.
It's Lee's.
Yeah.
And
Yes.
do you have a question about it, Mr. Madcourt?
Well, yes, Commissioner Fisher had a question about number 5, and I emailed you people about it earlier too. What is the purpose of number 5?
All right. One moment, please.
So it's the lead.
Just to provide some clarity, I was mostly concerned about if that would include domestic violence perpetrators, and Angie answered that somewhat in her report, but I was just concerned about if the Class C felonies would include those and if they would be released.
Okay. No, the domestic violence offenders in those would not be released. That's correct.
Commissioner Fisher, does that answer your question about number 5?
Yeah, I just wanted clarification on that since
Yeah.
we've been working on a lot of different levels to deal with this challenge. So thank you, Sheriff.
Yeah.
So we're
Sheriff,
ready to,
comments on number 6, which allows the sheriff to revise the jail capacity management plan to allow for more forced releases to accommodate the new capacity.
Was that, I'm sorry, I'm having a hard time hearing you, Steve. Was that a question of us, of the jail management plan, or you're just making a statement on that?
I think he's just saying that in the emergency ordinance, it allows you more flexibility on adjusting the capacity. And I think we're willing to do that.
Yes, thank you.
All right. Anything else of the sheriff?
No.
All right. So any questions of the sheriff? Who's up?
I do not see any, Mr. Chair.
Okay.
Do we need a motion?
No, we're not there yet, Paul.
Okay.
All right. Thank you, Sheriff. Oh, wait, go ahead. Anything else, Stephen?
Not for the sheriff.
Okay. Thank you, Sheriff, for your time. And Nancy and Dr. present, she's gone. Thank you.
Ready?
Ready.
Okay, so number 7, it concerns a request by Sustainability and DTD to have a waiver of any late fees or discontinuance of solid waste service for those providing solid waste pickup in unincorporated Clackamas County. That is item number 7. I previously circulated that to the board, and they seem to have no objection to it. Any questions on that one?
No.
Number 8 is authorizing our hearings officer within our code currently to hear and rule on violations of emergency measures. That is something that we currently do not have in our code, so this would authorize the hearings officer to hear those matters as opposed to the board or as opposed to circuit court. It would not preclude circuit court enforcement, but it would allow for a streamlined approach for a hearings officer to rule on any violations of any emergency measure.
Can they appeal to the?
Yes.
Okay. Any questions there?
No.
Seeing there isn't any.
Thank you. Number 9 is something that was pretty much brought to attention by Commissioner Humberston. And what we are saying with this one is if folks who are placed in housing for periods of longer than 30 days, the law essentially says that they are no longer transient housing, they're no longer guests at a hotel. They could be subject to the restraints of the residential landlord-tenant law, meaning that they would be tenants and you would have to go through the eviction process. And the eviction process, as we know, is currently on hold. There's a moratorium on commercial and residential imposed by the governor. So this would allow for hotels and other lodging providers to not be subject to eviction and residential landlord-tenant law if they have a tenant that stays over 30 days or if they are placed there for medical observation, isolation, quarantine, and or recovery. And it's what we're trying to do is carve out an exception to state law and some of the rigors of state law and allow for a bit more flexibility for the lodging provider.
Hey, Ken, where'd you come up with that one? That's a good one.
The lodging providers asked me, because I'm on the tourism board, whether or not those rules would apply. The hotel initially asked the question, and then folks from the Airbnb industry also asked the question. They basically are concerned that, here they are either having it imposed upon them or voluntarily trying to help us with the housing issue on a temporary basis while we're dealing with this crisis. And they were very concerned that they would end up having to follow all of the eviction rules and regulations that a normal tenancy would require. Didn't seem fair to me for them to have to do that, especially under these circumstances. So I asked staff to see if there was a carve out, using Stephen's language, to give them some freedom from that particular restriction. And assuming that we would approve that, then I would ask that our EOC folks and Gary reach out to those providers and let them know that there is at least some protection for them.
We are not providing legal advice to anybody. There's no guarantee of this. We're including it in here to give us the potential defenses should it be asserted later. There's no guarantees.
Got it.
This is similar to what we did for the Veterans Village under number 9. Number 10 is we're trying to dovetail that with another provision of state law that basically says if a lodging provider accepts vouchers that are government subsidized by the county or a county contractor, and these individuals stay longer than 30 days, then they also would not be subject to the landlord-tenant law. So we're trying 2 different approaches to ensure that lodging providers are not going to be faced, for example, with holdover tenants who stay for 32 days, and then the hotel or the housing operator would need to go to court and try to evict these people, which would take probably a very lengthy period of time because there has been this moratorium and there's going to be this backlog, most likely, of eviction proceedings taking place as well. So this is a second attempt to kind of provide the lodging providers with a certain sense of protection. Again, no guarantees, but we're trying to be as and comprehensive as possible.
Thank you, Stephen.
Very good.
And both of those, of course, are going to be, when this emergency is over, those restrictions, of course, will be lifted on, the tenant would no longer be considered a guest at that time. They would have to vacate. So 11 is this, you would delegate authority to the county administrator and his designees to implement and enforce any of these emergency measures. Right now, we don't have a clear enforcement mechanism. It doesn't go to code enforcement. It doesn't go to the sheriff's office. This would allow Gary or his designees to enforce aspects of this, whether it is the waste hauling component, which would probably go to sustainability, or if it were the price gouging component, which would probably go to county council, or if it were the housing component, it might go to HCS. So this doesn't require the board to have to reside or to preside over every single one of these. You give authority to Gary, it would be much more responsive and nimble in that regard as well.
Any questions on that one?
Yes, I do. I understand the purpose is to not incentivize people to violate the rules. I get that, but does this, the way it's worded, it just kind of have a concern about obligate us or policing or any of that, as far as how would that actually be handled? Give me an example on how would that fine, who would issue the fine, and how would that be handled?
We're not talking about issuing fines. We're talking about number 11. First off, I'll run you through an enforcement situation though. Number 11 would say that the county administrator can enforce any of the emergency measures. Let's say, for example, that we find that there is a market that is charging $12 for a dozen eggs. That arguably would be a price gouging violation under number 4 of your previous first addendum, and Gary would be in a position to assign the enforcement mechanism of that. It would be just like any other code enforcement component. Somebody would be cited by way of a letter, notice of possible code or emergency measure violation, and they would be sent notice of that. And what number 8 of the second addendum to your emergency order says that it can go to a hearings officer who would schedule a hearing and would provide notice of the violation, give the offender an opportunity to appear and defend him or herself. So it would be the same essential process that we have now for code enforcement violations, a little bit expedited, a little bit truncated. All due process rights would be maintained, and the hearings officer could fine up to $500 per violation of the emergency measure. That is a penalty provision that has been in Appendix A of our code for a while, so that's not new, the $500, but it would give the hearings officer that authority. Does that make sense?
Well, I understand all that, but my question is, give me an example of someone who violates it and how that would be implemented. We would file a claim. Who would file the claim with the hearings officer? How would it get before the hearings officer?
Again, it would be Gary would do it himself. He would give it to code enforcement. He would give it to sustainability. He would give it to county council. There would be a notice of proposed violation issued to the suspected offender with the hearings rights, like thou shalt appear and hear at this particular time and place. If they don't show up, they would default. But if they did show up, they'd be able to defend their situation. It'd be similar to what we currently have in place, and the hearings officer would be the decision maker on that.
Okay, so that paragraph, that second paragraph under number 11 is part of number 11. It's not part of the entire document.
It's part of the entire document. It was there from from the addendum.
Okay, all right. That helps clarify it. I thought it was specific to 11.
Yeah, so again, that the $500 fine is part of our code already. We didn't change anything. This is just notice of that.
Okay, thank you.
Thank you. And so in addition, I would propose at number 12, in light of, as you know, the board had its first emergency measure was a temporary moratorium on residential and commercial evictions. The governor has since followed the county's lead and imposed statewide moratoriums on those, and to eliminate any confusion, to be more of a housekeeping type of measure, I would propose that the board vacate or rescind emergency measure number 1, and that way you can lift that moratorium language from the county's emergency measure, because the governor has implemented one which would override it and which would control. So there'd be no question about what authority people were proceeding under or what rules folks needed to follow. They would just resort to the governor's order.
All right, so is that the last one?
That would be the last one. If the board was in agreement that rescinding number 1 was the right thing to do, I would redraft this and include some language to that effect and get the final document in front of the board for consideration at their Thursday business meeting.
So no motion today, just a nod, and then, okay. We good to move forward?
Commissioner Humbertson?
I have one question.
Yes.
On the rescission portion, can the language make it clear that it hasn't gone away, that the language shows that the governor's order still is in effect?
Absolutely, Commissioner. I can make sure it says that, and I'll circulate it later today.
I just wanted to be sure that people don't take the assumption that if we drop it at our end, that all of a sudden it all has gone away. So I want to be very clear.
Absolutely.
Thank you.
All right, so thumbs up to move forward for Thursday. Okay, thank you.
All right, we're horribly behind schedule, so let's jump ahead to advisory of boards and commissions appointments, and then we'll go to the policy session.
All right, thank you, Administrator Schmidt. We have 3 ABCs. We have the Library District Budget Committee. Staff is recommending new appointment of Danielle Kanan. The Emergency Medical Services Council, staff is recommending reappointment of Vince Stafford, Richard Newton. Stephen Duhart, Philip Moyer, Matt Gale, Jason Mahal, Dr. Sean Stone, and new appointments of Joshua Santos and Dr. Sarah Present. And finally, the OSU Extension and 4-H Service District is recommending reappointment of Rob Kappa and Rob Guttridge.
So moved.
Second.
Been moved and seconded to approve the slate as suggested. Any further discussion? All those in favor say aye. Aye.
Pull the board.
Oh, excuse me.
Commissioner Humberton,
Aye.
Commissioner Fisher,
Aye.
Commissioner Savas,
Aye.
Commissioner Schrader,
Aye.
Chair Bernard.
Aye. Motion carries unanimously. Next item.
So Chair, I propose we go to the policy session next, and then we can loop back to finish issues after that, if there's time.
Okay.
All right, let me promote the attendees and we will get started.
You guys tell I'm laying on my couch.
No, we can't. Except when your head disappeared, Chair.
Yeah.
Okay. Kevin, you tell me when.
Sheriff Roberts can go, right?
Duke, Dave, can you hear me?
I can hear you.
Okay.
I can hear you too.
I don't see Dave Cummings.
He is there.
There he is.
There he is. Great. Okay. Great. So, commissioners, the policy session today is to discuss an internet service provider pilot project. We have the team from Technology Services, Dave Cummings, Dave DeVore, and Duke Dexter to present. Go ahead. Go ahead,
Your
Dave.
mic?
Go ahead.
Your mics, maybe?
Yeah. Dave, Duke, yeah, there you go.
I had to unmute myself. What I have today is finally the most updated version of what we call our operations business plan for CBX. I think this has kind of evolved over the last couple of years. Brian Neva helped out, Duke Dexter, Scott Brown, Mr. Rob Campbell from Clackamas Community College Business Department, and that's probably about it that's had a hand in this. It's probably, you know, I wish we would have jumped on this a couple of years ago with the COVID-19 stuff coming up, and obviously an extremely critical need for people that are remote in the county to be able to work from home, for their kids to be able to do online learning and stuff. It's a real shame that we aren't connected out there yet. And it's still going to take a little bit of time, a little bit of money, and a little bit of patience while we build our CBX, what I call our CBX enterprise, which currently provides and sells dark fiber throughout the county and adjacent counties. And if you read through the operations plan, you'll see that in order to keep going with this concept, we recommended a couple of proof of concept projects that are more or less a little bit of low risk to see if we can do this type of operations. One was to partner with ISP, and that would be the Kiwanis project that you approved in the past. We're partnering with SandyNet. They're going to provide the ISP service to a group of homes up Highway 26 and expand on that as the business picks up. There'll be revenue coming in for that, not as much as would be if we were their ISP, but it's still revenue. And that's what it's all about, is how do we get revenue to expand our fiber footprint within the county and the rural areas within the county. We can reach those homes so that our citizens can work from home and still be sustainable with what they're doing. And it's a real travesty that they can't right now. And I want to be able to provide that. To be able to do it, I need the resources. I need the funding, I need the staffing, I need the expertise to be able to do that. And this operations plan outlines the first attempt to do that. Another part of that, of proof of concept, because we proposed 2 of them. One is to go to business parks in the county. We don't specifically have to go to one park and catch all the businesses in there. We can catch different businesses throughout the county that are close to our network. We want to be able to, you know, people say, you know, you don't know how to be an ISP. We don't totally agree with that. We do have a gentleman on staff, Scott Brown, that was with SandyNet in the city of Sandy. He knows how to be an ISP, but we want to be able to prove it and be able to prove that we can be sustainable through a proof of concept project. And that's the one that outlines us being a business and picking up some businesses. And it's not real profitable at first, but as you pick up more business, it becomes more and more profitable, like anything else. And beyond these 2 projects, we'd like to expand out. Maybe there's an area called Colorado Road out southwest of Sandy. About 175 homes out there, another residential area that has been crying for internet service. I think they contacted Gary just a while back to talk to him about it. But that's an area in the future we could expand to. But first, we want to do proof of concept projects to prove that we can do this, be sustainable. We're totally debt free. We want to remain that way as much as possible. But since there's really no general fund from the county that's going to support me, I got to use whatever I can to get whatever money I can and resources to build that and to be able to expand throughout the county. We're building our staff. We have permission from Gary Schmidt to expand our staff so that when we bid on projects, we have our own staffing that could go out and do that, totally funded, totally sustainable by our own revenues, which will make us a lot more competitive to be able to do that and do it a lot cheaper, and then expand on that staffing if we're approved to be an ISP. And that's outlined in the operations plan. So in a bottle of wax, I need to be able to reach those homes eventually out in our rural county so that those folks won't be in the situation they are right now where they can't go into work. They have to be able to work to bring income in, and they're going under. And that's a horrible situation. And I need to be able to provide access to all those people. And this is the only way that I know of doing it. Duke, do you want to add anything to what we're doing on these projects and where we're going with this?
No, I don't think any kind of new data, but just as an FYI, kind of as a catch up for the Kiwanis project, we're actually installing this week to some of the initial cabins or the residents up there for the Kiwanis project. And so that starts this week. And hopefully we have somebody within a week or 2 kind of actually live on the new feed. Okay.
And another thing I should mention, because it's all about getting revenue to do this, and we're a self-sustainable business and trying to grow, is if we're approved to be an ISP and do some proof of concepts, we're then eligible to apply for the USDA grants. And we've already talked to the gentleman that approves those grants. And he was excited about what we're doing and about us being debt-free right now. And for us to be able to provide access for all, I need to be able to seek all the avenues I can to get the funding, to get the resources, to do the bills, and get the partners through the telecoms to be able to do this. That's the only way to do it. I wished we would have been 2 years ahead of ourselves. There have been a lot of people that are in the remote areas right now that would be able to work from home, be able to feed their families and pay their mortgages. It's a travesty that they can't. I don't know what else to do. I only have so much money and so much time and so many resources, but we're building it. I just need the support from the board to be able to do things to get things done for this county.
All right, Chair Bernard and then Commissioner Savas.
So Dave, I think the business plan is very lacking. I think that I need an explanation on how one becomes an ISP and why we wouldn't. Is it a money issue, or is it? I don't understand why we would. Well, explain to me. Is it a money issue?
You have to be staffed, and you have to be able to support being an ISP through customer service. Right now, SandyNet does it, but they're in just a contained area. It's easy to support that, easy to provide the high level of customer service. We're talking about doing it throughout the county. So we need to be able to make sure that we are staffed to do that. We have the customer support staff to answer those calls and to be able to provide that service and keep the service up and going.
So why not in the little project we're looking at? Why isn't it? I mean, how many properties are there? Why couldn't we just ISP that and have one person who manages those customers?
Are you talking about the Kiwanis project, or?
Yes.
Well, first of all, the Kiwanis project, we're only on contract with SandyNet.
Okay,
yes, we could do that if we haven't had permission yet to be able to be an ISP.
That's the problem.
So that's the problem.
Okay, so I still don't why. I don't understand why we wouldn't do the ISP part if we start small and we build staff as we grow.
That's exactly what we want to do.
Okay, so the next measure is, I mean, what we need to do, well, my opinion is we need to start there with an ISP and then hire somebody to write a business plan that is, we can really, plan further out into the future. But I
agree. Yeah, we've tried. As we all know, I've tried over the last couple of years to bring people in to do the business plan. We even sit down with Rob Campbell from the community college. That's his business. This is what we have right now is the best we can do. But I think as we go forward, I think you're absolutely correct. We need to get an expert in that will help us develop this plan even further. This plan we have right now is an operations plan that'll just get us started.
Yeah.
But as we grow, like you said, start small and start growing, we need someone in that really knows the business.
Yeah.
And to help us expand that and make it happen as we grow. So I agree.
I don't know. I don't understand. I don't know the timeline, but let's say, yeah, we okay an ISP, doing our own ISP today.
Yes.
I don't know how long it takes, but we have staff who are familiar in customer service that are home, not working. Could we get somebody on staff to start ramping it up, the customer service end of it, without having to hire out?
Well, Duke, you want to answer that one? Because all you have right now is just Scott and yourself, although you are doing, have some PCQs which you're developing for for additional staff for the bid projects. So could we have a person in there that would be able to do that? Would Scott or yourself be able to do that?
So Chair Bernard, kind of a clarifying question on that. Is that becoming an ISP just for businesses or an ISP for business and residential?
I think it's business and residential, but we're doing a pilot project, so we're not moving into the residential. Well, we are sort of residential portion right now, but to start small, do the pilot project, have personnel to do the customer service end of that, and then after we do that, then we move on to the bigger picture.
Yeah. So so to kind of be clear, the Kiwanis project is a pilot and it's a partnership. So CBX is providing the infrastructure. Sandy Net is going to be the ISP. So I think what you're discussing, though, is in a different area, potentially for residential, is that CBX would not only be the infrastructure, but it would also be the ISP.
Correct.
And so if we defined a small area, and let's just, for argument's sake, say it was that Colorado Road with 175 residents along that road, yes, CBX would be able to be the ISP and do the infrastructure, be the ISP, and be able to handle that small amount. It's a confined area. Now, once you start talking, we open up to businesses and residents anywhere within Clackamas County. We are nowhere near staffed to be able to handle that quantity.
And that's where we get the business plan going. After we do this smaller one, then we could do the rest. So I'm done. I think I got my answers.
Last piece I have on that, though, is you ask, why aren't we the ISP? So one, obviously we haven't been given authority to do that. But two, it always takes money. And there's going to need to be some seed money. So by the time we build out the infrastructure, we buy the equipment, we more or less buy the ISP that we will redistribute to a particular area. That's all the seed money. We need that money to begin with. And then once we hook people up, we start collecting back the revenue, their monthly fees. And generally, we've been trying to, anything we look at, have between a 4 to 5 year ROI.
Yeah, so what's the seed money amount? That's the problem with the business plan, right?
Well, if you wanted, so let's just say, again, just Colorado Road, it would be somewhere around $400,000 to $450,000.
Yeah,
okay.
It's expensive.
All right, Commissioner Savas?
Yeah, well, you covered some of my points, and Dave, I really appreciate you identifying the need, especially now. No one a year ago would have predicted where we are today as far as the needs, and as far as distant learning trends that are taking place. I am really, I'm deeply saddened at the fact that a lot of our folks in the rural areas don't have really much of anything.
Right.
And that's extremely concerning. That's why it was raised when we discussed this last week. I brought this up, and very concerned. And I don't understand. It's not clear as to. You haven't made it clear. You've touched on it a couple times, Dave, as to why we don't have the business plan. And let me just clarify a couple things before I really go on. I have been pretty passionate about getting the coverage and meeting the board's goal of getting coverage out in the rural areas from day one. And I can explain why, but I won't go there. But I've heard the calls. I've talked to people face to face out in the rural areas who have nothing. Okay, so the need's real.
Yeah.
So I don't want any confusion over the motivation, but what I'm curious about is what happened with Rob's efforts as far as the business plan, because what we have before us today in these pages, which I've read 4 times, I don't see the path. It's not defined in here as how we get coverage out into the rural areas. I see baby steps here, but when I see in the plan here, 5-10 year opportunities, that doesn't get us to the funding for $450,000 for a small particular neighborhood. And that's the path I need to see in what would be a business plan. So what happened there? What was the breakdown? I thought that Rob was making some progress and that would be coming out in due time. So could you elaborate on that, please?
Okay. Well, first of all, I agree. This business plan that we have right now is just an initial kickstart. It's not an overall business plan for the whole county. I mostly did a lot of this and put it together with input from Rob and from Dave Solis, which not a whole lot happened there. But, and I think I've told Gary that having me write a business plan is kind of like having me lay an egg and I'm not a chicken. But Rob gave us some input. I was kind of hoping for more from them, but that's what we got. And I thought this would be a good start for us to get things going. And you're right, we need an expert that's really educated in doing extensive business plans like this to do the whole county. But at least this would get us started. And if I could get the tools to at least be an ISP and start doing that, I think as time goes on, we can continue with this and then maybe find somebody. These guys aren't cheap. Get somebody in that could do a good plan for us.
Okay, so
I've been real surprised at the input that we've had so far from everybody that says they can do a business plan and haven't really done any better than I've been able to do myself. So,
well, yeah, and my goal again is really our goal. I think my goal is the board's goal. The board's goal is to get the coverage out in the area and do it within a timeline, because if we can't, if this plan or what we have here today doesn't get us there by the goal and the date set in our MFR, for example, then we have to look at some realities. Like, so what is it that we need to do? And while I am, on one hand, your point you made, Dave, was a good one. We got to do something. Doing nothing. So these are baby steps. But in the reality, I mean, I'm forced to say, how do we get to the finish line? And last week we had a discussion with Congressman Schrader about a potential large infrastructure bill. This is a program and a project that would be, maybe ought to be considered, because this is a nationwide problem. At NACO, when I sat in the rural caucus, this is a problem throughout the United States. The rural initiative, and Martha knows this as well, to get broadband out there. There's a huge need, but we know the economics. That's why it's not there. That's the reason we're having this challenge. It's economically not feasible.
Right.
It has to be capitalized, and if the federal government makes a grant and we capitalize it, great. So my question is this: how do we, knowing you got limited resources, and I see the staffing, you got some staffing things, you're gonna try and do that with your own budget, not general fund. I get all of that, but this positions us, it seems like this is designed to position us towards the baby steps. What can we do to position ourselves if we get capitalized by a federal grant? Would we do something different?
I think we wouldn't do anything different. We'd just do it bigger. I mean, the key component, and Jim hit it on the head, and you are too, is this is a lot of money to do this. It could be millions of dollars to provide fiber and internet access throughout the county to everybody. And I think the only way we're going to do it is to get grants. I wish when we initially started and got our first $8 million, I would have asked for $50 million. We just need to get more money. And the only way to do it, to get big money to do it quicker, is to get the grants. Nobody's going to come in, telecoms aren't going to come in and build out because there's no, and I don't blame them, there's no return on investment for them right now.
Yeah.
So the only way to get the money is to get the grants, and what we want to do is just start the baby steps that way, so we're headed that way as we apply for the grants and we get someone in to do a real solid, extensive business plan for us.
Yeah, well, I want to say this, is that number one, the old saying that for every crisis there's an opportunity. I think it can be said that broadband or internet throughout our country, in our rural areas everywhere, is now, I think, justifiably a necessary utility.
Yeah,
right? I think we can make that argument and get us out of the political situation that we're in. So therefore, maybe that's a game changer nationally. But
yeah,
on one hand, I just having that hope isn't really a plan. Hope is not a plan, but you don't have in here anything that indicates the greater plan. And I hear, Jim mentioned it, it was touched on a little bit. Dexter did as well. What are we going to do as far as a plan?
Well, I think we've discussed it already, and we know that this is an initial plan to get started, and we do need a bigger plan, and that will happen over time. But we need something to get I'm getting old. We need something to get us kick-started here. And even if we do these smaller projects, we're showing ourselves that we can do the bigger projects. And I think as we're going along with continuing on developing the overall county-wide business plan, that we can bring in resources to help us do that, and at least we're going forward with it. And maybe during this time we can get some big grants with some big dollars, because this isn't cheap. I don't know of any other any other way to do it. I'm not going to win the lottery and be able to fund the whole county. It's just not happening. We got to do it through grants and bringing revenue in as much as we can.
Let me pull this together a little bit. So first off, you need an ISP.
Yes, I need an ISP in my pocket to be able to start doing this.
So I think that's the first move we need to make, is the ISP. And then, you know, there are federal, Wyden talked about it too. He talked about, you know, the rural initiative and this stimulus package could be the opportunity we need, but we need an ISP to do that. And so my question was, what the heck's an ISP cost to just get it? You just buy airways or what?
There's several, if I may, there's several different components on that. One of it will be equipment, other will be some IP addresses, and then there'll be the signal itself. And so all three kind of components make up that for us to be an ISP.
That's $400,000.
No, $450,000 was for us to build out infrastructure and become an ISP to Colorado Road. Let's say somewhere between maybe approximately $150,000 to buy the equipment, IP addresses, and the signal.
Yeah, in the business plan, if you look at the, we were talking about going to a business, being an ISP, we figured it around a little over $30,000 to get started as an ISP to about 7 different businesses. So most of the money is in the infrastructure of putting the fiber out there. It's not in being the ISP. That's the cheap part.
Seems like in order to move forward, we need an ISP, and we ought to figure out where we can come up with the initial small amount.
Yes, and
Chairman Bernard, Scott Brown is on this as well, and he works with CBX. He also spent many years and helped build up SandyNet. I think he might have some good input on this as well, maybe some clarification points.
Scott?
Kevin, are you able to bring him in?
Yes, he should be on.
Scott, unmute your...
I don't see him.
Should be coming there.
There you go.
Scott.
Right. After this, we have Commissioner Schrader, Commissioner Humbertson, Commissioner Fisher, and Administrator Schmidt with questions.
Scott, you're muted right now. You need to unmute your... There you go. Nope.
Yep.
There you go.
To address a lot of the concerns, I would say of what's made it so difficult to come forward with a business plan is we've gone stuck on a lot of different scopes of, what is broadband? How fast should we offer? Who's underserved? Who's overserved? All those types of details. And it's that nitty gritty that's really brought us to a halt most often. I would say phase one is just getting the permission of, you may proceed as an ISP as opportunities arise, with the end goal of moving towards providing service to the unserved areas, would then open up the opportunities for grants and federal funding, that type of deal. To accomplish that goal, there's no one technology we can use. Every area is going to be different. Colorado Road could be different from Lolo Pass Road. And so it's been really difficult to try to come up with one business plan that fully encompassed all the startup costs required to do all the different areas, because there's going to be several different types of ways that we do that depending on the scenario to make it most cost effective for the county, but still meet our goal of providing services to those that are unserved. just starting with the permission of being an ISP, we could get started as an ISP for even less than the 30,000 that we mentioned for the business service, because that included getting services to the businesses, and then kind of work up from there as things grow and expand.
That's helpful. Thank you. So let's go to questions.
Right. Commissioner Humbertson.
Thank you. We're about a year and a half behind where I was hoping we would be a year and a half or so ago, 2 years ago. It's clear that the need is there. We saw the need 2 years ago that the rural areas needed the service. We don't have the kind of money where we can just go out and build a great big system. And the board made it clear that debt was not the way to go to do this. It had to be essentially cash on the barrelhead. So the idea is to do incrementally and opportunistically those areas that we can do with the lowest amount of cost with the biggest benefit going forward. The Colorado Road concept is an excellent idea because of its proximity to Sandy. Let's assume for the sake of argument a worst case scenario, and we find out that this is not for us. It's close enough to Sandy for Sandy to be able to take it over without any significant impact to the clients out there and move forward. On the other side of the coin, if we're successful, it's a good proof of concept and we can expand it from there. Having an ISP is what will get us in the long run the kind of capital that the grant money can provide to expand the system more rapidly in the rural areas. That's our goal. But because of the upfront costs for areas that are way out in the rural parts of our county, you can't start there. You have to start where you can get a bigger bang for your buck and be able to expand from that point with the proof of concept. The other point I would make is that Rob Campbell came out of the public utility area and was always looking at this from a full-scale plan as opposed to an incremental plan, and wasn't able to scale down to an incremental plan very comfortably, which is why we have what we have now. This allows us to go forward with the least amount of risk to CBX and to the county in general. And if our proof of concept works, we can expand and grow. If it doesn't work, we can get out of it quickly without too much impact on the customers, and go a different tact in terms of figuring out how we get more coverage out in the rural areas. But it's demonstrable that it's needed. And we need to make a decision. We've been waiting a year and a half to make a decision. Let's make a decision and give staff an opportunity to get this done. I don't know what else to say. We've known about the need for 2 years. We need to stop stalling and get to work.
Okay, Kevin, who's next?
Commissioner Fisher, and then Administrator Schmidt, and then back to Commissioner Savas.
Thanks, Kevin. So I try to comprehend this report. One of the most important things to me is looking at the last attachment of the report, which shows what the need is, where the underserved areas are, but I'm really confused by it because the part that is white says only one provider reports, and I'm looking at it sideways, so it's a little challenging. Minimum requirements. So I don't understand from the information that I've been provided where specifically the areas are that don't have coverage. I know anecdotally from hearing from people, but I don't see on a map. So I just want to take us back to our original goal. Our goal is that everybody have internet across the county. I'm not convinced, and I'm probably even more concerned after today, that we are the right entity to be the ISP in the rural communities. I would really like to understand why our current providers, we can't more incentivize them to provide the service and utilize a business model that might access this federal dollars to get the job done, but maybe we're not the right person to do it. So I'm not thinking that we're ready, but I really want to get this done. And I almost think, Gary, that this needs to be looked at through our emergency operation process, that this is an emergency. We have children that aren't being educated. We have people who can't work. We're looking at a future of going in and out of social isolation to control a virus. This could be going on for quite some time. And how can we figure out the need? What are our resources to get this accomplished, and who is the best to do it? What is our best path forward? We don't have that right now.
I just want to answer one thing that Sonia mentioned. So we've been doing this for 9 years. Is it at least 9? When did we get the first grant?
2011. Yeah,
Okay.
we've been building fiber.
Yeah. So since 2011, we've been trying to get the other service providers to get out there and get them lit. And it hasn't happened. There's just no incentive for them to do that. There's not enough people to do it. And that's why they're not doing it. And some of them are just kind of fading away. But when there are partners available, they're willing. The problem is you can't get the big guys out there. And so the goal here, that's why we got the original grant, I was there, was to light the county because those providers aren't doing it. And they still have not. Okay, go ahead. Next person.
All right, Mr. Schmidt.
Yes, thank you. So commissioners, I'm here to implement your direction and to make sure you have the information you need to make the best possible decision you can. You directed staff to provide you a business plan almost 2 years ago, and I thank the staff on this call who've done their very, very best, but it's not the plan you need to make an informed decision. I'm concerned on things I'm hearing on this call that we're going to formally become an ISP first and then build the plan later. I'm sorry, I cannot recommend that to you. The intent today was to have you approve a proof of concept or a pilot project to then help you make the decision to become an ISP, not to become an ISP and then build the plan later. So I'm hearing different things from staff that's not in your staff report. I think that you're right, Chair Bernard. We've been reaching out to internet service providers for a long time, and they've not been willing or able to either go out to parts of the county that need it or to lower their costs. But that was before a month ago happened. So what outreach have we made to telecoms in the last 30 days, asking them how have their plans changed to better support their customers? I don't know if that's happened. Maybe it has. I have concerns, commissioners, that I need you to know about. You're about to become approved, becoming a major utility that we're not prepared to implement. So I again ask you to consider a small pilot, which I do support and recommend you do. But again, and I apologize, Dave Cummings, we should not become an ISP first. We do the pilot first to then guide whether we become an ISP. So if there's semantics there, I think we need to clear that up. Thank you.
I think there's a semantic problem there, but.
Yes. Mr. Chairman?
Yeah.
Yeah, the pilot project has to be an ISP. That's the whole point. If it's not an ISP, we're doing the same thing with CBX that we're doing with SandyNet or any place else that we're doing CBX. You actually have to have a pilot ISP in order to be one so that you can then qualify for the grants. That's the whole point of the pilot. Now, and the idea of doing it in a particular locality that could be transferred to another ISP if push came to shove and we found this was not in our best interest or the client's best interest is why geographically you make a decision such as Colorado Avenue. But you've got to be an ISP as a pilot project in that area to be qualified for the federal grants. If we're not an ISP, we don't get the federal grant money. That's the bottom line. Unless somebody changes the rules between now and then. And right now we don't see that happening. So
it's only a little bit of money.
Yeah, exactly.
All right, Commissioner Savison, Commissioner Schrader. You're muted, Paul.
I thought it was Commissioner Schrader first. No?
No, it was you and then back to her.
Okay. So getting back into Gary's question about is it semantics or not, and I'm hearing maybe it's not semantics, but I don't want to belabor this, but so we keep on talking about the federal grant money. We get federal grant money, and that's not in the plan as a potential, right? So what does that amount to? Give me. Is there got to be a comparable? If we were an ISP and we're suddenly have this status and we got a proof of concept, okay, so that opens the door to what? How much money? I mean, what are the average grants for a county our size?
Go ahead, Duke.
Yeah, so it depends on area. So when you apply for the grant, so we're talking, and let's just be specific, it's the Reconnect through the USDA. And there's 3 types of the grants that they do: 100% loan, 100% grant, 50-50 grant loan. And so in each one, what you do is you identify an area. We could identify all of Clackamas County, but not all of Clackamas County qualifies for this grant money. And so the rules on the grants have changed a bit over the past year and a half. You would identify an area, and the service level itself had to be reported that they received less than 25.3. So 25 megabits download, 3 megabits upload. And now those limits have changed. They've now dropped to 10 and 1. And so those areas that actually can receive the grants are much smaller now. And I know for a fact, City of Sherwood applied for one of those grants. They had an area, to be able to get the 50-50 piece, 90% of their area had to be under 25.3. And when the feds came out and tested the area, they denied them the grant. And when they asked, well, we know this area does not receive 25.3, where did you go? The feds were not specific on where they were testing and how it failed or not. The other information out of that is all of these grants are fed to determine these areas from a form. It's called the 477 form. Those are self-reported forms. So in the case, let's say you're Comcast and you serve an entire area, you say, well, I can serve 25.3 everywhere, when in actuality, they may not actually serve 25.3 level.
That's right. Okay, well, I'm not looking for.
And so to go back to Commissioner Fisher had pointed out that map, and it's kind of important. If you look at it, you can kind of notice the little blue areas, two providers, 1 provider. So this is kind of like 1 providers. But if you kind of look at the Sandy area, it's kind of highlighted. We know they can get at least a gig. We work very closely with SandyNet. We know that they are fully covered. And so the kind of the wider areas, kind of some of the lower areas we know of, let's say the Beaver Creek areas, the frontier areas, those areas that we know aren't served, but they don't qualify per the Fed's rules.
Yeah. So Duke, my question was, how big are the grants? Money? How big are they?
They had, I want to say the first round was 650 million. The second was 500 million. I believe this year's 100 million. And again, it depends on the size you do. So if we picked out an area and said this area is underserved and we're going to need $2 million to serve it, that would be, and then we were approved, we would get the $2 million.
Okay.
Okay. Well, I'd be okay putting an egg or 2 in this basket of this POC, right? But I don't want to put all our eggs in this basket. I don't want to have a false sense of security that we're going to meet our goals and our timelines, because I don't think we're going to get there this way. I just don't see. I don't see us getting there. I mean, if dropping a couple eggs and a minimal amount of money to get an ISP is maybe a foot in the door, and we can get a grant that size, great. But I just not convinced that is where we need to put all of our effort. I think we need to have another or approach or 2. I really do, and I just don't see the plan to get there. That's where I'm struggling with this.
Right. Commissioner Schrader.
I'm sorry, I've been up and down trying to keep the dogs quiet. Okay, so what we're talking about is looking at a pilot project. But in order to do the pilot project, I'm just trying to clarify this in my own head. you have to have an ISP. Is that correct, gentlemen?
Yes.
So it's
that's the
like,
purpose of it.
it's kind of like you can't do one without the other. It's a chicken and an egg. My thing is, what is the risk if we do a small pilot project? Because this county, number one, you know, we're not going to have any extra money from general fund for anything like this. And number two, what's the timeline? We're in the middle of a crisis. The area you're talking about serving is totally black. They just do not have any access at all to internet service. That's number one. And number two, what is the timeline to get this up and running? Is it going to be in time for what we're dealing with now? So that's the concern I have. We can start it, but when's the payoff? And because we're in the middle of all of this, and I'm supportive of it because I do know that NACO, as Paul said, and as Ken knows, this is across the United States that people don't have rural access. This is a huge deal, and the USDA has significant dollars to do this. So, Gary, are we talking about a small pilot project just to see? But if it doesn't work the way we say, then, because I understand if you're talking about a larger system, you don't have the capacity for a larger system now. And really, when you're talking about rural access, you have to have an entire system. So I just want some clarity. You can't do a pilot project unless you say with Sandy, can't you just help Sandy be its own ISP, I guess? Anyway, I'm trying to be supportive here because I do think it's extremely necessary. I'm questioning the timing. Anyway.
Well, the Eco Northwest says this could go on for 2 years. And can this project be up and going in a year?
Okay.
Dave or
Do you want me to respond? Commissioner Schrader, so real quick out of this, remember we are doing the Kiwanis project right now. So it is a residential partnership with SandyNet. We're doing construction this week. So yes, it'll actually be up probably before this is done. The second proof of concept we talked about was actually to go to a select number of businesses, roughly 6 or 7 businesses. If given permission to do that, we could probably get that up in the next 3 to 4 months.
So you're asking for permission to do more than one pilot project?
That's correct.
Yes, we're asking
Gary,
you to
I'm going to ask Gary, what's your opinion of that, Gary? That's what I'm hearing. So we already have a pilot project that's in process. You're asking permission to add additional pilot projects?
Yeah, if I may respond to that one real quick. The Kiwanis project that we've been granted permission, it's a partnership. SandyNet is the ISP and Clackamas County is the infrastructure. In the second proof of concept, CBX is both the ISP and the infrastructure owner.
Yeah, and Martha, on that business project, as we outlined it in the mini operations plan, we were going to do that for 3 to 6 months and not charge. And most of those places we're going to go to, and here's the tough part of it: a lot of the businesses already have some type of ISP going into them. And we're recommending that they continue with those ISPs, whoever they may be. And they're not going to charge for 3 to 6 months. And at the end of that, say 6 months, if we're a lot cheaper and providing a lot better bandwidth, and those businesses choose to go with us, then at that time we start charging them. So the businesses don't lose anything. We lose a little out-of-pocket money for the startup, but that's it. But if we're a success, then we're picking up businesses and we're making money, and the proof of concept has worked, showing that we can be an ISP ourselves. And we're gonna want to be an ISP throughout the county because, as Paul mentioned, why isn't this happening throughout the county? Why aren't the telecoms doing this? Well, they have investors, they have to make money, and that's why they're not. There's just not any money in it for them. And even when we build out to some of these remote areas, some of the telecoms still don't want to be the ISP for us. So we have to be the ISP to get to these areas. We don't have to show a big profit. We can do it a lot cheaper than the telecoms. And I think we're talking about all the correct components of what we're doing here. Just we're asking today just to do a second proof of concept to be an ISP ourselves. When you're not the ISP yourself, you're really reliant on the person that is the ISP and doing everything according to their rules. And they could actually boost the prices up to the customers where we wouldn't. So there's a lot of really good reasons why we would want to do that. And, you know, timeline, you know, if this thing could snowball, we could get going, we could start getting grants, we could start putting this stuff in. It took us, oh, Duke, how long did it take us to build the fiber ring throughout the county?
The first initial grant was 3 years, 3 months.
So, you know, it's going to take a while, but this pandemic could go on a while, and then something else could come up down the road that will be in the same situation. So if we don't do something like this, we're never going to get out there.
No.
It's just not going to happen. I mean, seriously.
All right. Administrator Schmidt to answer Commissioner Schrader's question, then to Commissioner Savas.
If I remember the question, yes, Commissioner Schrader, you are going to, if you go forward today, you are approving becoming an internet service provider, but only for 2 small areas for the purposes of a pilot, not countywide. After that pilot is complete, you will then decide if you want to become an ISP countywide. That's what I'm hearing is what you will decide today.
Yes.
So want to jump in here. So Dave, I want to build on what you're saying. I have, you know, in light of the need, I have a hard time, and this is really going to lead to a question. I have a hard time providing and going through all this effort, spending $38,000 on providing a secondary service to businesses that already have a service. And when there's people out there that don't have anything. So if this second proof of concept was 7 homes, for example, to leverage becoming an ISP, or 10 homes or whatever, that, I think the optics of that and the justification of that are probably above reproach. But to do it for a business that already has it with the hope that they'll like ours better and not address the real need out there, I think I have difficulty with that. Is there so here's my question. Is there a way to do a proof of concept, but do it to the residential areas that have nothing?
I think Duke kind of answered that when he said Colorado Road, in order for us to get infrastructure out to do that area and provide an ISP service, would be $421,000 to get the fiber out there. We were just looking at the business side because it would be a lot cheaper for us to do that and actually prove to ourselves that we could be an ISP and then kind of grow from there. Yeah, on the business side, we would have to compete. That's the name of the game, and maybe when we did that, maybe the telecoms would bring their pricing down because it's quite expensive to go into the. It's quite expensive for the businesses to get the internet connectivity. So it's just, you know, it's money to go out and do a proof of concept out to a rural area. You got to put the road in to get out there, which is the fiber, and that's expensive to do that. So we were just starting out small, proving that we could do this as an ISP, and then growing that and trying to get money so we and be eligible for the grants to where we could go out and spend $421,000 to get to a rural area to hook up houses. It's about the money right now. It's expensive to do this. I don't know what else to do to get the money other than get grant money. And to get the grant money from USDA, you have to be an ISP.
So why can't we implement that on the current project we're doing right now with Sandy and just substitute ourselves and become the ISP with that? Do we need a second proof of concept?
Well, why we can't do that is because we already have a contract with SandyNet to be the ISP. If we would have done this a year ago before we started the Kiwanis project, that would have been the way to go. But we're down the road too far, and we're already connected into and legally bound to SandyNet to do that.
So yeah, so is this Colorado project, is there any low-hanging, cheaper projects that are more residential than that cost less than $425,000 potentially?
The reason we picked the Kiwanis project is because we were adjacent to the residents on that one. That overall, we're doing that with the city of Sandy for about $137,000. We picked the low-lying fruit on that one. Colorado Road, I believe, I remember it's about a 3-mile build out, kind of from start to finish, and then of course all the drops to the homes, and that's why its cost is significantly higher. But I don't know of any that are, let's call them, not getting service right now that would be less expensive than Colorado Road. But I haven't searched every. I'd have to admit, I haven't searched out every scenario.
Right. Well, I think it proves one thing: we don't have the capital to do this. I mean, we have the capital to become an ISP apparently, but we don't have the capital to build the board's goal.
Well, you're absolutely correct. You're absolutely correct, and I think I've mentioned that in the past. The timeline is really short, and we don't have the money to do it. I think
unless we did a 1-800 kind of scenario.
Commissioner Humberton.
Thank you. Trying to. This is frustrating. Look at it as a two-track approach. Okay, if we are an ISP and we're able to get grant money, then that'll expedite our ability to actually go into the rural areas more quickly. But that may or may not be possible. So you look at a second track, and the second track is if you go into the business community, the model is the same as it is for the water district out there on 212, 224. You can make a profit providing this service to the businesses that will help you build the infrastructure into the rural areas. Cash on the barrelhead, because I'll repeat again, the board did not want to go into debt to do this. So you can't just go into the rural areas without a large amount of capital, either from grants or having built a successful ISP in an already served area that will make you a profit that allows you to invest in the infrastructure going outward. So it's essentially a two-track approach. In doing this, you're proving or not that you can effectively do this work. If we find that we can't, we are close enough to others to turn it over to them without a detrimental effect on the customer. If we find that we can, we have two tracks to go forward in building out the infrastructure to the rural area. If we do nothing, it's not going to happen. So we have to make a decision, do a proof of concept, find out whether it's going to work or not work and which track works. And we do it with the minimal amount of risk, which was what the goal was when we began the discussions 1.5 years ago. I don't know how any other way to put it out there. It seems very simple to me, and has a minimal amount of risk. I will acknowledge that the goal of getting it out there by 2022 to the whole county, I think that was what it was, probably is no question about it. It's not realistic, but if we don't do something, it's never going to get out there. I'm not locked into a timeline of it's got to be done by 2022 or we fail, but it's rather get something started and get it going. Not unlike what Sandy did. They started out small and then they grew. So again, don't know what else to say. I think it's pretty basic. We do a pilot, the pilot projects as recommended by staff. They come back to us quarterly or every 6 months with a report. And if they are able to either generate income from an already served area or they generate income from grants, they come back to us and say, we want to expand based
Scott,
on
can
our
we do this,
success.
Scott?
I'm sorry?
Oh, I said, Scott, can we do this? You were at Sandy.
It's very difficult for us to do in a 2-year time frame, but I think the best goal is a areas that we can partner, areas that we can incentivize other providers to get moving, do that, and then in some areas, ultimately, it's going to fall back to us to do. There's a reason for the last 20 years that these areas haven't had service. So I think it's a mixture of all three. It's just another tool in the belt, but I'm confident that we have proved over the last 10 years that we can build fiber networks, and it's something that we could accomplish. I don't want to be a provider for the entire county, but in some areas it's doable, it's feasible. It's going to take more than 2 weeks to do. It's going to take more than 2 years potentially in some areas to do, but it's feasible.
Thank you, Scott. Sorry to put you on the spot.
Right. Commissioner Schrader.
So I'm really trying to be supportive of this, but I just don't feel like I can make a decision today. I've got to be honest. I'd like a little more time to think about this. We are in the middle of a pandemic. Can we come back at this in another week or so, or in a month or so? Because I think what we're really talking about is risk. I'm worried about the risk because we're facing unprecedented times where if we'd done this sooner, no, I don't think the same level of risk would be here. And I do like the idea of still trying to partner. And I guess I'm trying to understand, why aren't we partnering more with some of the smaller providers? Have they just not wanted to partner with us?
That's absolutely correct.
Because
There's
because can't you work with them to apply for the grants and work with them and have them, that's kind of a hybrid.
Yes.
Does that make sense?
I'm raising my hand here.
It's a hybrid where you're working with I know the big guys are never going to go out there. Okay. They don't care. It costs them too much money and it's not whatever. But I still am not understanding why part of the pilot isn't working directly with some of the smaller providers that have an ISP where you can work with them to apply for a grant and actually do the same thing without us taking a risk right now. That's what I'm thinking. Are they just not responsive? They just don't want to work with us at all? They don't?
I can answer that pretty easily.
Yeah.
Small providers we have talked to, we've actually have partnered with a few of them now on like getting service to Bar and Park, et cetera, as a hybrid model. They're a lot more open to things. What we find is the areas that are most on-served, not underserved, but completely on-served, are in frontier communications territory, and they're currently going through bankruptcy right now. And a lot of these smaller providers like Reliance Connects or Clear Creek, they kind of feel like that they don't want to stretch their current staff thin in expanding to areas that are outside their geographical boundaries that they have right now. So to go to a company based in Estacada and say, hey, do you want to serve homes up on Lolo Pass? They're like, we're going to roll trucks from Estacada to Lolo Pass all the time. So a lot of it has come back to them being like, we're interested in the stuff like right around our local areas, but those areas are already being served, or we already have plans, or we're already applying for grants.
All right.
So there's areas that are truly the most on-served. They're like, we don't want to go out that far. That stretches our staff and affects the response times of our biggest customer base locally.
Have you,
across the board.
When you talk about frontier, have you talked about subsidies to get them out there? I mean, there's more than one way to work with with a business to do
Frontier,
that.
and then previously Verizon, and previously GTE has collected hundreds of millions of dollars in subsidies for rural access over the years, and hasn't done much. Now, I will throw out there, while they're going through bankruptcy, a company is in the process of buying Frontier in this area, and they have a goal of bringing fiber to these areas. It's a large service area that they cover. They're buying out Washington, Oregon, a large swath of the West Coast that Frontier has. To how quickly they will start acting once they comes out of bankruptcy and this company fully buys them and all their assets. How quickly will they start doing that, and how quickly will they be doing that in our county? That's yet to be known.
Right. Commissioner Savas and then Administrator Schmidt.
So Martha's question was one of mine, but one other one that I was thinking about as well is that, and you kind of touched on it, Scott, when you mentioned boundaries. So my question is, can we become an ISP and be the customer and prove ourselves within one of our buildings or the Veterans Village or some other operation that we have and prove the concept without having to make such a geographic type of challenge of 3 miles or more? I mean, is there some, or are the boundaries that succinct that we can't overlap with another existing provider?
We're not restricted by any boundaries. I think what you're saying is do we have to go to a place that we're going to be competing with another provider? Is that accurate?
Well, I mean, let's just say that we want to become an ISP. We wanted to serve the sheriff's office, and we use that as a proof of concept.
Probably already served.
Well, I know they're being served, but why can't we do it just to prove the concept at the lowest investment?
We've been doing it to the libraries, city halls all over the county.
No, as an ISP.
But so we are. So all county facilities at this particular time, the county in general, technology services is the ISP. They buy a signal and then they distribute it to all the county facilities already in Clackamas County.
So it's not really proving that we have enough brains to do this job. It's more, can we financially be successful? We know we can provide ISP. We know we can hook people up. We can provide ISP. We know that.
Yes.
Well, the fact that it's not feasible and that the low-hanging fruit's been picked, I mean, is clearly. I think the struggle with this is it's not really doable because of the cost, and there's not a return on investment that you can actually do it. You might be able to find a baby step here, and then maybe in 10 or 12 years develop enough capital to do another baby step. But in essence, the fact that it's not out there is proof in the pudding that it's not within reach. That's Dave's point all along. And that's why Sandy, years ago when I talked to Jeremy Peacehold about this, you know, they did it and they were successful, but they had to limit it within an area where the density and the geography was close enough to make it feasible. They couldn't expand that outside their boundaries because of the financial challenges of doing it. That's where it doesn't pencil. That's all. It's all about making this pencil, and the fact is, you know, it doesn't pencil.
All right, we need to set this aside. It's 12:24, and I think we need to say that next week we're going to make a damn decision or we're going to let this die. I'm frankly, 9 years we've been talking about this, and let's just put this, let's have a decision next week, get your questions answered, and move forward on this. But it's 12:24, and I've got a busy day ahead of me, as you all may very well have. So are we okay with that?
Okay. I agree. Let's either do it or not. And I'm very happy with building fiber. I'd be happier connecting everybody in the county, but maybe I'm just crazy and thinking too big. But I need to make a decision on it one way or the other. So I agree.
All right. So are we done for the day, Gary? Or we have more on it?
We haven't done commissioner communications, but you could pass for today, or we could come back to that.
What
Pass.
times are filming, Gary?
It's at 2:00 p.m. today.
Okay. Anybody want to do commissioner communications? Paul?
Not a communication per se, but I want to talk briefly about the timing of the listening sessions at 2:00. It kind of blows a hole in the day, so to speak, or the afternoons. I was just wondering if we could, I'm all for having a standardized time, but it might be better to make it like an hour later or an hour earlier. I'm thinking like an hour later. But I'm finding that, for example, trying to schedule things before and after is almost, it's very difficult. So all I'm asking is consideration, not necessarily today, but maybe staff can look at the logistics of moving this to a 3:00 start versus a 2:00 start.
All right, we can look at that. Makes sense.
Staff's looking at it, Commissioner.
Okay, thank you. That's all I have.
Ken?
Tourism hasn't met and the Fair Board have not met since our last meeting. They are expected to meet this week. So probably by next week I'll have a report, but I have nothing this week.
Thank you. Martha?
I don't have much to say, except it was fun working with both of you yesterday distributing food.
Yeah.
That was actually a really, and I'd like, when are they doing it again? I'd like to be able to do that.
Every week they're doing it. And
Okay.
we'll try to coordinate that a little bit because I've had AMR wants to volunteer. Lynn Peterson's off and she wants to volunteer. So we'll work on that. Thank you.
Well, how do we get the information? Does it come directly from Angie?
That particular program, I believe, is run by the Sheriff's Department, which is once a week, but that's all coordinated through our Emergency Operations Center, correct, Gary? Yeah.
Yes, through our EOC coordinator.
Sonia?
Okay, great. Yeah,
Sonia?
I don't have anything to share today that I haven't already shared.
All right, thank you. I'm good. Well, with that, anything else, Gary?
Jim, do you still want a strategy meeting today or cancel it? We're an hour late already.
Let's cancel it.
Okay.
We'll do it tomorrow then.
Yep.
Martha, we can't hear you. Your mic's
Tomorrow
off.
works.
Okay, tomorrow it is.
We're
All
done
right.
today.
Thank you, Stephen, everybody.
All right. Thank you all.
See you too, Gary. All right, thanks.